David Makhura has promised to improve the province for residents there. There was a protest yesterday outside the Charlotte Maxeke hospital, with people demanding that it be reopened fully. Parts of the institution are still closed. The casualty department is closed. They've been closed since that fire last year. The Gauteng province now saying it'll only be fully reopened next year. Professor Adam Mahomed is the head of Department of Internal Medicine at Charlotte Maxeke Hospital. He joins us now. Professor Mahomed, good afternoon to you, sir. What impact is the closure of parts of the hospital having on its patients and the treatment that they receive?
Good afternoon. Thank you for having me on your show. So, just for clarity, is the casualty section hopefully will be opening up in March, thanks to the hard work of the Solidarity in getting that place ready and fire compliant. However, it doesn't mean that the hospital is back to normal working. We're still running at less than 40% capacity. The loss of at least 210 to 220 beds, or about 24% of our total bed capacity, has not been addressed. So our current situation is we are struggling along and giving pieces of good care, but not the whole. We are eating a piece of the fruit, but not the entire fruit. And the people that are suffering are the most vulnerable, long waiting times, long queues, and those that need specialist tertiary care have to wait a long time. So we are not moving forward. We are stagnant.
Last week, the Gauteng province said publicly that work was being done on the hospital building every day. Is that true? Are there construction workers on the site fixing it every day?
So he is correct. There are construction workers from Solidarity employed by a private funding organization to fix the hospital, which is predominantly focused on Block 1 fire rehabilitation. But there is absolutely not a single worker doing any work to get the area that was directly affected by the fire 10 months later sorted out, except for props that are sitting there for the last 10 months. So there's no actual construction workers in the relevant areas that are employed by the DID or the Gauteng Department of Health that is adding any value into our hospital.
That's amazing. So, I mean, we have this area that was badly damaged and no one's doing anything about it. Is there any, I mean, I can't imagine, I mean, I'm frustrated. I can't imagine how frustrated you must be, Professor, so excuse me. But I mean, have you been given an explanation as to why no one's doing anything?
With the latest media statement where they brought up the issues of corruption and people that were up to nonsense during this time, people from Department of Health as well as DID were implicated. But you must remember, at all our meetings that we had in the last few months, every single person was involved at our hospital. The Premier visited our hospital, the MEC of Health, no matter how many of them came, the DID, HOD was at our site. So nobody can put their head in the sand and say, I didn't know. The conversations have been happening for 10 months. Now all of a sudden, National Department of Health wants to get involved and try to assist, and there's proclamations made. And you are putting out a date for 2023 when we don't even have a structural assessment or a proper assessment of the needs of the hospital done. So how can you put a deadline when you don't know what you're doing?
Sure. I mean, I've seen so many different explanations. It's about fire doors, that there's a dispute between the province and the city of Joburg over health and safety regulations. I mean, do you believe those explanations? Then this week was the claim 9 people were suspended for what happened with the Anglo Gold Ashanti Hospital near Carltonville, and that there was an investigation into corruption. There seems to be a different sort of recipe of reasons all the time.
So the city of Johannesburg has given us strict rules and regulations that we have to follow before we become compliant, and they give us a written documentation to say that the hospital is now safe for utilization for patients. And one of the Achilles of that is putting fire doors. But fire doors are one part of the aspect. A lot of the building is divided by drywalling, and that's not fire compliant. So Solidarity and the current remedial work is putting actually specific fire bricks into trying to assist from spreading fire or smoke in the future. But the fire doors, we know that we needed these fire doors from month 1. And the fire doors that are currently in the hospital have been only and replaced by Solidarity, and not a single door, to my knowledge, has been paid for by the Department of Infrastructure and Development or the Department of Health. So the 5 doors are a challenge to get, but we have 10 months to do something. And we don't even have a fraction of doors made by anyone.
Sure. I mean, the nightmare scenario, because whenever we put this, and I put this in various interviews to the Gauteng Health Department, and there's always this, it's fine, patients are being treated, they're being treated at Helen Joseph, they're being treated at Chris Hani Baragwanath, but what this must be doing to those facilities, and the quality of treatment cannot be the same, because there simply aren't enough resources to go around.
I get really angry and frustrated by anybody who tells me that patients are getting care at other hospitals. The problem is our system in Southern Gauteng was broken with all the hospitals working. You now take away one major hospital and you can tell me that there's capacity at the other hospitals. I'm in contact with my colleagues at Chris Hani Baragwanath and Helen Joseph. Their numbers have gone up 200-300%. The resources that they've been given is still limited. So you can't tell me that they are being accommodated. There are certain services that you do not get at Helen Joseph Hospital and Chris Hani Baragwanath Hospital. It only occurs at CMJH. So you cannot be painting a rosy picture when the quality of care is not right, when the quantity of care is not right. Where are all the mental health care patients' beds that we've lost? How many more beds were you supposed to have opened prior to the fire? People are painting a rosy picture. People who were in charge during this last 10 months are still the people in charge for doing what we're doing. I have heard not one sorry or one apology to say, sorry, we could have done better. Sorry, we can do better. Again, it is just politics at the expense of the most vulnerable patients. And they are taking the bulk of the hit.
Professor, the worst nightmare is that something else happens to another hospital in Gauteng. And then we're down 2. I mean, if it's taking so long to fix just one, I don't even want to think about what could happen.
There are so many infrastructure problems at Chris Hani Baragwanath Hospital and Helen Joseph Hospital. All of us need the assistance to run a proper hospital. And we need to start by being honest and saying we have failed. It's only when you have insight can you move forward. Currently, I see lack of insight. And I see lack of honesty and transparency about what we're doing. Have a meeting, tell people where we are. There are lots of cloaks and daggers about these people we suspended in December for fraudulent activities. Why did you not tell us in the hospital that these issues were going on? It takes another 8 weeks before you have a media statement to say, oh, we're doing this. But there's still nothing in writing to tell me this is what's wrong with the building, this is what it's going to cost, and the Development Bank of South Africa, Southern Africa will fund it. How much are they going to fund? The entire amount? We don't even know costing, yet people have given an end date. That's dishonesty. An end date without no roadmap is a blatant, I can't even tell you my frustration with the dishonesty.
Professor, I'm so sorry you're going through this. Thank you for your time. I do appreciate it. Professor Adam Mahomed is the head of the Department of Internal Medicine at the Charlotte Maxeke Academic Hospital in Johannesburg, president of the South African Gastroenterology Society as well. Professor, thank you. It's a story that we spent